We're both physical therapists at Sheltering Arms Institute. So we are a 114-bed inpatient rehab hospital. So we're located just west of Short Pump. So at our hospital, we treat a variety of patient populations, including a large emphasis on neurological patients such as stroke, traumatic brain injury, spinal cord injury. So we're here today to talk to you about one of the pieces of technology that we use frequently in the clinic. So the EksoNR robotic exoskeleton. So it's made by Bionics, and the use of robotics to assist patients to regain walking function has been gaining popularity over the past decade in the rehabilitation setting. So thanks to donors and our Sheltering Arms Foundation, Sheltering Arms Institute was able to acquire the EksoNR. So the NR portion stands for neurorehabilitation. The device weighs about 50 pounds, but it's engineered so the weight is sort of pushed through the ground. The patient doesn't feel that weight on them. So it is a battery-operated exoskeleton. It's designed to help individuals with leg weakness or paralysis stand and then take steps over ground. So we use it for individuals with neurological conditions, including but not limited to stroke, brain injury, and spinal cord injury. So individuals must use an assistive device, so that can be a walker, cane, or crutches, and they have to have at least one therapist walking with them, although frequently we use two individuals. As you can see in the picture, we've got one person standing next to the patient and then one person kind of hiding behind them. So before we discuss the components of the EksoNR, we briefly wanted to discuss the foundation of our work as therapists, so you can better appreciate how it's used as a tool for recovery. So therapists in inpatient rehab really look at these 10 principles of neuroplasticity. They're sort of the foundation of the work that we do in order to drive recovery. So the concept of neuroplasticity is designed as the brain's ability to adapt or to learn or relearn function previously lost. So this could be lost as a result of trauma or a stroke. In short, it's the brain's ability to heal and recover. During acute stages of recovery, the brain is in a critical period of plasticity. So use it or lose it. So if you don't use it, then people lose the function. Use it and improve it. Specificity. So this means that you have to work on a specific task to improve it. So if you want your walking to get better, you have to practice walking. Repetition matters. So the number of times you do it. A lot of research shows that we need to take 1,000 steps a day after a stroke to regain function. Intensity matters. The task has to be difficult. It's got to challenge us. Time matters. So this is sort of how quickly after an event you introduce therapy and recovery. Salience matters. So it's got to be important to you. So, walking is really important to a lot of people. That importance helps to drive neuroplasticity. Age matters. So younger brains are more plastic. Kids recover quicker, than as we age. Transference. So if we work on similar tasks, it's going to carry over into walking. So if we work on stairs, that's going to carry over into our walking. And interference. So if we work on tasks incorrectly, that will also translate over. So, and we'll talk about sort of how these components are used with the Ekso. So the Ekso has two battery packs. You can see it sitting here in the standard chair. We've got a battery pack on each side of the device. And then we have joint motors. So here, on the left side is the knee joint and a motor that drives it. And then here is our hip joint and respective motor. The entire device is adjustable. So prior to using it, we measure the patient's their hip width, their leg length, and then the numbers telescope out on each side. So on the left, you can see our lower leg, and on the right, the upper leg. So donning the Ekso, so we have someone sit in a chair. You can stand up, turn, and sit in the chair, or we can do a sort of transfer over into it. The legs of the device move open so that they can make more room to fit the patient in. And then as you can see in the bottom pictures, the legs will come back together after we've got everything strapped in. After we have the legs strapped in, we strap in the torso component. And then you can see in the next two pictures, the backpack component of it. So overall, the setup time takes around 10 minutes. It can take a little bit longer on the first time just because we're making sure that everything is looking okay. And then, as mentioned earlier, users must use an assisted device to aid in balance. So this is based on the person's arm function, so how well and how strong their arms are, and overall balance in the device. So we can either use a rolling walker, and this is a little bit wider than a standard walker, and it has little cutouts on the bottom so someone can push up using the device. But the width of the walker accommodates the exo on the side of the person. We can also use a cane, or we can use forearm crutches. But the forearm crutches definitely require a lot of balance. So now I'm going to turn it over to Mary, and she's going to talk to you about who is the most appropriate for the exo device.
So who can use the exo? The device does have some physical limitations. Users must weigh under 220 pounds and be between 5 foot and 6'4". Users must be able to tolerate standing with or without help with stable blood pressure. And users must have near normal ranges of motion at their hips, knees, and ankles. And they must be able to follow basic commands and communicate any distress or pain when they're in the device. So the exo is controlled by a remote, which you see here. The remote offers various assist modes and patient-specific settings. At the beginning of a session, the therapist must program the device based on the patient's ability and goals for the session. These settings can be adjusted during the session based on their performance that session. So here you can see two different displays on the remote. The top display shows where you can change the assistance level and mode. And the bottom screen shows the exo in standstill mode. So a patient is standing in the device and has just walked for 8 minutes and 13 seconds. You can see the options to either sit or walk, as well as the real-time feedback numbers in the bottom right. These numbers tell us how much the exo is assisting compared to the patient's effort. And all of this feedback helps guide decision-making for adjusting settings during the session. So how does the robot take steps? There are 3-step initiation programs. In first step, the therapist must trigger each step via a button on the remote. This typically is where we start a patient if it's the first time in the device, but we tend to quickly progress from this basic program. In pro step, the patient triggers the step once the forward and lateral weight shift targets are achieved. These weight shifts are part of our normal gait mechanics to allow the swinging leg to propel forward. In Pro Step Plus, the patient triggers the step once they achieve the lateral weight shift target and then lift their back leg for swing initiation. Lifting the foot off the ground releases pressure from the foot sensors. So for Pro Step and Pro Step Plus, we are not having to push a button to trigger each step, so patients can get into a smoother, more normal rhythm of walking. So how does the robot assist with the stepping? There are 2 main modes, trajectory controlled and trajectory free. In looking at this picture of the swing phase of gait, you can draw your attention to the leg colored in blue. The blue leg depicts the leg swinging through, which is what we are discussing when we are talking about trajectory. So trajectory refers to the step length, step height, and step time. In a trajectory controlled mode, step length, step height, and step time are all controlled and are configured based on the patient. So the patient must step within these specific parameters. In a trajectory-free mode, the patients can move their legs in a self-selected swing pattern, thus having more freedom with stepping. So putting it all together, how does the robot assist walking? The exo is set to one of these 4 programs based on the legs being either trajectory controlled or free. In bilateral, both legs are in the trajectory controlled pattern, and we can adjust how much the robot is assisting. In 2 free, both legs are in a trajectory free pattern, and we can either add resistance or assistance to the legs. And the final 2 options, left affected and right affected, have only the right or the left leg in trajectory controlled, and the opposite leg is free. So now that you have more of an understanding of the exo, I'm sure you can appreciate how the device helps achieve neuroplasticity. The primary principles it helps achieve are specificity, repetition, and intensity. The exo is a great tool to help patients achieve an increased number of steps in a session and thus greater repetition. While using the exo, patients are certainly getting task-specific training in walking, and patients are able to perform the walking practice at high intensities based on appropriate adjustments to the Exo settings. We wanted to just quickly touch on what the research is saying about the use of the Exo following neurological injuries. Here we have various studies cited. Most of these studies have compared the use of the Exo during PT sessions versus just conventional or standard PT. These studies demonstrate that the use of the Exo shows greater improvements in walking speed and distances, greater improvements in balance, improves symmetry with walking, improvements in bowel and bladder function after spinal cord injury, decreased muscle spasticity and pain, and psychosocial benefits, improving mood and self-satisfaction and lowering stress. So we'll be switching over now to our live demonstration of the device. But before we do, does anyone have any questions?
So how long has this device been in clinical use?
It has been, we acquired the device approximately a year ago. The device has been on the market for a number of years, but they have expanded. It was initially used for exclusively spinal cord injury, and they have kind of expanded the use to other neurological diagnoses.
Okay, doctors, I don't see anything else in the chat right now.
All right. Okay, we're going to go ahead and turn our video off and mute so you don't hear all the commotion, but we're going to be making our way out to the hallway for the demo.
Okay, thanks very much.
All right. Hi, everyone. We are on the hallway here. We've got Kel with us. And then we've got Zach Crum, who is one of our physical therapists, who's going to be helping us out. So Kel is here with us. He sustained a spinal cord injury that affected his thoracic spine and has affected his legs with walking. So currently they are sitting in the device. Sorry, our screen is a little small here. I'm trying to make sure you all can get the best view. Are you all ready to stand up? So they're going to demonstrate a stand. The device is going to help him lean forward. They're going to adjust his feet. So it's going to help him lean forward. The device is going to help him stand up. There we go. We're standing up here in the hallway. They're going to get set real quick. He's been in the device a few times, but typically we check hips, make sure the device is fitting well. So Zach is going to stand behind him to help with his balance as needed, and Mary's going to control the remote.
No, he's good. Feel okay? Mm-hmm. Down to 7.
So they're working on decreasing his assistance as he's going. So it's telling the robot to work a little bit less, and he's got to work harder. So it's a neat setting that we're able to decrease the assistance. So the robot will show how much he is doing. And as he continues to do more, we can keep turning down the assistance as he's walking. So you might be able to hear the beeps as they went by. The beeps are an indication that he is shifting his weight far enough to be able to take a step. So a bit of auditory feedback for patients. They're going to do a U-turn here. So they completed their turn. They're going to get back into walking mode. They're continuing to monitor how much assistance he's needing as he's going.
So we're gonna do one more turn to your right. Ready? Gonna be right.
We're going to do another U-turn here.
Stand.
So they're going to get into standstill mode here. So there's a couple questions for you, Cal. So what do you like about using the Exo?
I like that I'm able to stand and move my legs again. It's it feels good. It makes me feel a little bit normal.
Yeah.
Other than just being in a wheelchair.
Absolutely. How do you feel like it has helped in your recovery?
I feel like it helps my muscles and my bone density just a little bit more. Kind of like help build the muscle back in my legs a little bit more since I'm not able to use them.
Yeah. Okay. Thank you. They are going to do a sit now. So similar to the stand, they're bringing our Exo tends to live in a wheelchair. It's got its own special wheelchair. So they're going to sit down into the chair. They're going to put it in sit mode. It's going to help him lean forward and slowly lower him to the chair. Thank you so much, Cal. We really appreciate it.
No problem.
Thank you, Zach.
Yeah.
All right, we are going to turn the video off momentarily, and then we'll have time to answer any other questions for you.
Okay, very good. Thank you, doctors.
Sorry about the back and forth, guys.
Right.
We are a working rehab hospital, so we have to make sure we maintain other patients' privacy and keep other people out of the video. So we appreciate the back and forth with us.
Well, thank you very much for that demonstration, doctors. That is an amazing piece of technology, definitely. So can you tell us about how long does the battery last on that device and how long does it take to charge?
Yeah, so it actually comes with 2 battery packs, so 4 batteries in total because it's 2 batteries on the device. And this morning, Zach had, I think, 3 or 4 patients in it from like 9 to noon. And just before the presentation, we swapped out for fresh batteries. They were down to like 50%. So they do last a fair while, but there is a backup set that we always keep on charge, so it's an easy swap in.
Okay. And you had mentioned earlier there are limitations or there are restrictions as to the size of the patient that can use that device. Are there child-sized devices or youth-sized devices that are available that you're aware of?
We only accept individuals as young as 12 at our rehab hospital. So we do not have any pediatric. Exo, to my knowledge, does not make any pediatric devices. I am not aware of any that are on the market at this time.
I'm sure they're in the works, but
yeah,
not on the market yet.
Okay. So how long is an average session with a patient working with that device?
typically either an hour or an hour and a half. As we mentioned, it takes about 10 minutes or so to set up and a few minutes to take down, and occasionally a little bit of problem solving time. But usually we have patients for either an hour or an hour and a half. But what I like to remind people of the setup time is we wouldn't be able to take those steps sometimes without doing that setup time. So, sometimes they're able to get in 300, 400, 500 steps or more, which they wouldn't be able to achieve without the device.
And it's nice. The device actually tells us kind of the uptime. So all the time they're even just stood, not actually taking steps, as well as the actual active walking time. Mm-hmm. And just being up on your feet certainly counts for more than just sitting in the chair. So it's a good amount of time that they're up on their feet when they're using the device.
How do you know when to decrease the amount of assistance? Does the device provide feedback, or is it just patient feedback? Or
yeah, so as Kel was walking, Mary had the remote, and so it said, that the device was helping 59%. So then they were able to decrease the assistance level so that the robot would only do 60%. So he had to do 40%. There are some safety mechanisms that will not they won't let him fall as he's walking, but as he's going, the robot is only going to do 60% of every single step. And if he does more, then we can bump it down so the robot does less. So it does give you that feedback on the little remote that Mary was holding.
So we had a question here. Can the device be used for strengthening a person who has had back surgery and is losing mobility?
That is not necessarily the primary indication of the device. It's really more designed for neurological patients. There are different use cases for it. One of the limiting factors with back surgery typically is then they have back precautions. And so sometimes the leaning forward can break someone's precautions. But it's really patient dependent.
Can you talk a little bit more about what kinds of cases this would be appropriate for?
What kind of cases?
Yes, ma'am.
Yeah, so here we use it a lot for spinal cord injuries, like the patient that was demoing it out there. We use it a lot with our stroke population. Like I mentioned earlier, we can get into like having like the left leg completely controlled and a little more restricted, and like the right leg totally free. So that would be great for somebody who's had a stroke on the right side of the brain that has affected the left side of their body. So let's say they're totally paralyzed with that left leg. The robot can help move it. And as they get better, we obviously decrease that robotic assistance. And then their right leg that's totally intact, because that area of the brain was preserved from the stroke, they're free to move that leg like they typically do. So I would say stroke and spinal cord injury are the biggest folks that we use it for here.
Yeah, most of the patients that we are using it for, either with our spinal cord injury population, might have no leg function or some preserved. And, our stroke population need at least quite a bit of assistance for walking. They're not what we would consider community ambulators. They're typically primarily using a wheelchair at this time. So we're using it to regain that function as much as we can.
Can you share some examples of noticeable improvement that you've seen with people using this technology?
Yeah, after we set someone up and we do walking with the Exo, we always do what we call like an overground trial, or walk a little bit outside of the device. And it's to sort of see the carryover, because patients are not taking this device home with them. And, it's definitely a device it's one of the devices that we use. But it's really great to see the carryover after using the device and seeing if they have improved walking function afterwards.
We had a question here. Does the type of shoes the patient wears matter? Do they have to be like soft soled or flat or rubber soled?
Typically just tennis shoes. As long as they're tennis shoes, then usually we're good to go.
Yeah, and we have them use those same shoes because when we take those measurements, the shoes kind of incorporated with that lower leg measurement. So we have to make sure they're wearing the same shoes each time, or we might have to tweak the lower leg adjustment.
Let's see. I don't see anything else here in the chat. So we'll go ahead and bring it to a close for today. Thank you both for being here, doctors. Really appreciate your time. It's a fascinating piece of technology. So thank you all for joining us. And thanks to, again, our speakers for helping us discover more about our world. Please join us next week on Wednesday, November 10th at noon for Rats in Richmond, Where They Live and Their Potential Risks to People, presented by Dr. Jonathan Richardson. He's a professor at the University of Richmond. We love our rats here at the museum. We have our rat basketball players, but these are city rats. These are not our our trained rats here at the museum. Our rats are lovely. You can register for next week's talk at smv.org. Each talk is free to attend. It is open to the first 300 registrants. Thank you again for joining us today. Until next week, stay safe and stay curious. Thank you all for joining us today.
Thank you so much.
Thank you all.